We will discuss about colonic polyps in this video. So what is a polyp? It is a small growth from the inner lining of the bowel. It can have a stalk or it can be sessile. Men get polyps more compared with the women. Uh, and as we become older, we get polyps more commonly. And there are some syndromes where we get polyps like Lynch syndrome and familial adenomatous polyposis. There is a family history of cancer or family history of polyps. We have to get tested for this. Polyps are not hemorrhoids. Hemorrhoids are enlarged or dilated veins, and they are not polyps, and they don't cause cancer in future. So, what are the symptoms of polyps? The polyps can bleed. The bleeding can be minimum, or sometimes the bleeding can be very large. In that case, it is seen as a black color. It is called melena. And when the polyp is bigger, it can cause intestinal obstruction or obstruction to the bowel also. You can see the capsule here, which is obstructed because of the growth of the polyp. So which polyps are worrisome? The polyp is more than 1 centimeter. If there are multiple polyps or if the histology is unfavorable, then the polyps are worrisome. So what we have to remember is that all polyps are not cancer. They don't cause cancer. In fact, majority of the polyps are benign, and there are only special kinds of polyps which can become cancer over time, like this. These are adenomatous polyps. So we have to get a colonoscopy done when a person is aged 45 years or above, and we can use a small biopsy forceps to remove the polyp, or we can use a snare. If the polyp is big, we can go for endoscopic mucosal resection or endoscopic submucosal dissection. Or if the polyp is very big, we can go for surgery also, and where the polyp segment is cut and the other areas are joined together. So summarizing, it's an abnormal growth and they can lead to cancer, but not all polyps are cancer. And the risk of polyp becoming cancer depends upon size, number, and the appearance under microscope. Screening colonoscopy should be done above 45 years, and endoscopic removal of polyps eliminates cancer risk.